Welcome once again to Save Your Money, Save Your Teeth here on E-Radio, the podcast where curiosity meets dentistry, straight from the experts. It's Jan with you, as well as Dr. Clifford Yudelman from OptiSmile. We're here once again to take a deep dive into the world of dental care from a consumer's perspective. So if you're looking to brighten your smile, or maybe you just want to protect your wallet, Dr. Yudelman's got you covered with practical advice and the latest insights. So do stay with us as we uncover all these secrets to maintain both your dental health and your finances. A big welcome to you once again, Dr. Clifford Yudelman, at the start of another series.
Yes, great. Thank you. And thanks for having me back. I'm really excited. We about 34, 35 podcasts in, and we finally get to implants. Dental implants. Today, next week, and the following week, we'll be taking a dive into implants.
Well, okay, lekker. That sounds good. It's going to be very, very interesting. And the question we're asking today is, are dental implants right for you? So we're going to explore the suitability and the benefits. My first question to you, Dr. Yudelman, can you start by explaining what dental implants are and also how they function?
Yeah, so look, quite simply, dental implants are artificial tooth roots made of 95% of the time titanium, which is very biocompatible. They surgically place into the jawbone where teeth are missing. In essence, they're tiny little screws. When you see a dental implant, it just looks like one of those very small little wood screws. They don't really look like anything special. Over time, they fuse with the bone through a process called osseointegration. So literally, the body doesn't see the titanium as a foreign object, and the bone grows right up into the little grooves and the little recessions in the threads of the implant, and that's called osseointegration. My wife just recently had a hip replacement operation, and they removed the bad part of the hip, the top of the I think it's the femur and the hip socket, and they use titanium. They just clap it into the top of the bone there, and it engages, and the bone grows right up. It's very much like a hip replacement, but obviously this is for teeth, and you can walk on it and everything. In this case, once they're integrated, the little screws provide a stable foundation for replacement teeth. And we'll mainly talk about single crowns, bridges, or even dentures, and they function and appear just like natural teeth, and they restore both the aesthetics and the oral function. Sure, there was a long explanation about what they are and how they function, but we'll get into more detail as we go along.
Okay, great. So I also want to ask you, Dr. Yudelman, who is considered an ideal candidate for these dental implants?
So people who have one or more missing teeth that are looking for a long-term solution, people who've got adequate jawbone density and healthy gums. If you don't have, if your upper jawbone doesn't have a lot of bone, if it's very spongy, or you're quite elderly with osteoporosis, we'll get into things like how one gets around that. But generally, you want to have very healthy gums and good jawbone. And people who in good overall health, without any conditions that, again, we're going to talk about, certain conditions will impede any kind of healing. And non-smokers, or people that are willing to stop smoking during the healing process. If you smoke, you can't get dental implants. Very few dentists will place an implant in a smoker, even if you're a light smoker. So you've got to go on gum or get hypnosis or do something to stop smoking, at least during the period while the bone is integrating. And then you've got to be committed to maintaining good oral hygiene and regular dental visits. You can't just go, if you haven't looked after your teeth are now not in good shape, you go pull them out. You can't just go and put in dental implants and think that you're not going to go back to the dentist. You've got to look after them just like regular teeth.
Any general health requirements that a person should meet if they want to undergo a dental implant procedure?
Yeah, so you want to be in good health so that you can, with any surgery, you want to start off with, being in good health, that it heals nicely. You really don't want uncontrolled chronic disease. Like if someone's got uncontrolled diabetes or heart conditions, it's better to take care of those first. You need a good immune system. So if you're a person who's really prone to lots of infections, or you've got uncontrolled HIV or you've had other conditions where you've gone on immunosuppression, things like that, the healing won't be good. And in the same realm, if you've had radiation therapy, if you've had cancer removed from your jaw, or you've had any kind of head and neck radiation, it can get complicated. My late dad was a dentist, and he had some radiation to his jawbone, but he was able to actually get implants in Johannesburg. They took extra precautions, but there's always ways to do certain things. But in general, we're talking, yeah. And then you need clearance from a physician if there's any underlying medical concerns.
Okay. And how does one's oral health impact their suitability for dental implants?
So you need healthy gums. If you've got gum disease on your own teeth and you go and you remove a tooth, or if there's a missing tooth and you go and you put a dental implant in, the bacteria from the gum diseased teeth will also infect the dental implant. So you have to have a healthy, clean mouth. You need sufficient bone in the area where we're putting the implant, which, as I said earlier, we'll get into that. You can't have any active infections or a lot of untreated tooth decay. You got to make sure your mouth is in pretty good shape before you start with implants. Then good oral hygiene practices. We make sure patients are able to look after their teeth before we go and put in an implant, because if they're not able to brush or floss properly, the implant will fail. It can get infected. And sometimes you require preliminary treatment like bone grafting if there's a lot of bone loss. If there was trauma, say a front tooth was knocked out and the bone went with it, you've got to have preliminary bone grafting. It can take sometimes more than 1 or 2 surgeries to build up some bone again and then get the implant placed.
Doc, talk to us about the key benefits when choosing dental implants over things like dentures or bridges.
So implants can offer a permanent or somewhat permanent, durable solution that can last a lifetime. Although these days we're not promising we're putting an implant in that you're going to have it in 25 or 30 years' time. They can give trouble out of the blue 10 or 15 years later. We don't promise people that an implant is forever, but they do last a long time. Certainly longer than a tooth that maybe has a dodgy root canal that's been retreated and it's got fractures and it's got a crown, and now you want to do some hierodontics to try and save the tooth. In a case like that, sometimes an implant is better. So they prevent bone loss by stimulating the jawbone and maintain the facial structure. So if someone's lost 4 front teeth and they get implants, the bone will be maintained in that area. But if you don't replace the teeth, the bone disappears as well. So we sometimes get patients that have had a few teeth removed and they come to us 2 or 3 years later and there's no bone, because the bone belongs to the teeth. Once the teeth are gone, the bone disappears as well. And there's also no need to alter or damage or drill down adjacent healthy teeth. With bridges, we have to file down adjacent teeth into little nubs, like turkey teeth, and put crowns on them. There are ways to do bridges that you bond to the teeth that I'm quite in favor of wherever possible. We call it a Maryland bridge or a bonded bridge. But in many cases, an implant is superior with superior comfort and functionality. Bridges are very difficult to keep. Also, we'll get into the difference between a denture and a bridge and single crowns. And then, of course, you get better chewing efficiency and speech and improvement in overall quality of life.
Can you walk us through the dental implant process from consultation to the actual completion?
So it always would start with the initial consultation. You get a comprehensive exam and treatment planning. There's x-rays. There's 3D X-rays where you can actually see where all the nerves and the sinuses are. These days, it's very important that you get a 3D X-ray. It's very rare that a dentist will put an implant in without a 3D X-ray. At OptiSmile, we have a CBCT X-ray. We include a CBCT X-ray with all of our exams at no extra charge. You will generally pay about 3,500 Rand for a CBCT, and then also a 3D scan, like an iTero scan, like we do for Invisalign or injection molding. So that's using a little camera that we wave over the teeth instead of taking a goopy impression. And it creates what's called a STL, a 3D model of your teeth. And those images, the 3D X-ray and the 3D scan, can be combined, and the actual placement of the implant is planned using 3D guides. So then there's preparatory procedures like extractions or bone grafts or treating gum disease. And then during the implant surgery, the implant is placed into the jaw under local anesthetic. It's just placed, sometimes it's a very minor surgery. There's just a little hole made in the gum, and then there's tiny little drills to get a sort of the right angle and everything using a guide, and then progressively larger. And when you see an actual implant, they are quite tiny. It's not a huge, big thing. And most patients, after they have a single implant or a couple of implants placed, don't need anything further than a panado or two. They don't have a lot of pain. It sounds like it would be much more painful than you would think. Then there's a healing period, generally about 3 months in the lower, up to 6 months in the upper, for the implant to fuse with the bone. And then there's the abutment. We call it an abutment placement and restoration. So the abutment is the part that goes into the implant that the crown or the bridge or the denture attaches to. And then after that, you get regular follow-up care, so regular checkups to monitor the implant, to take x-rays, and to maintain your oral health.
Doc, I'm quite curious to know how these dental implants integrate with your jawbone, and also why is this integration so important?
So it's very rare that these days to hear about an implant that was placed that didn't integrate. It does happen every so often, but at OptiSmile, I can think of in the last 9 years, maybe out of literally hundreds of implants that were placed, maybe 3 that didn't integrate. And that's a early healing, that during the early healing phase. Once it integrates, the jawbone, as I mentioned, grows, becomes literally fused to the implant. And that fusion provides a stable and a strong foundation for a crown or a bridge or to attach a denture to. And it prevents bone deterioration where teeth are missing, because once the implant is there, the bone generally stabilizes. And implants can withstand, normal biting and chewing forces. And, the integration is very important for the longevity and the success of the implant.
Now, what are some common concerns that patients have about dental implants, and how do you, doctor, address them?
So the biggest thing is obviously fear of surgery. So we explain the minimally invasive nature and the use of anesthesia to ensure patient comfort. We do get patients that request sedation, and we have an anesthetist that will come in. It's not a big deal. It's just sedation. It's not a general anesthetic. The patient, we had a patient in the other day who had quite a lot of work under sedation, and they always leave with a big smile on their face. They have no remembrance of what happened, even though they were basically awake but sedated. They can't drive, obviously. So pain and discomfort, we manage the expectations. We give people information about how much pain to expect after the treatment. Like I mentioned, it's usually minimal. And pain relief options, it's very rare that I will prescribe something like a Tramoset or a very strong, I don't even like those microdols. I don't like anything with codeine. Patients can usually just take Panado or combine that with ibuprofen. And that's one thing that we discuss with patients, the fear of surgery, the pain and discomfort, and then of course cost. It's very important to discuss financing options and long-term value compared to other treatments. Healing time, providing temporary crowns or temporary bridges or temporary dentures, and encouraging the patient to be patient during the period when the implant's healing. And then highlighting, in terms of risk of failure, highlighting the success rate and the steps that we take to minimize any risks. So the dentist, I don't personally place any implants. I have a fear of blood. I don't do any extractions or implants, but that's why we have a number of different dentists that specialize in different things at OptiSmile, and we have 3 different dentists that do place implants, including an implant specialist, a prosthodontist that places and restores implants. He's been doing it for 40 years. He was trained in the US, and he's probably the most or one of the most experienced implant dentists in South Africa.
Okay, and any age considerations or limitations, doctor?
So not really. If a person's healthy and they look like they're going to still be around for the next 5, 10, 15 years, it's definitely worth getting implants. I mentioned my dad. My dad had some jawbone issues after cancer treatment, and he was already 80. And a few years later, he lost a few teeth that got affected, and he got implants, and he lived to almost 95, and the implants never ever gave him trouble. So definitely age is not a concern. We generally don't like to do implants before the bone has stopped growing. So you can't get an implant if you're 16 or 17. There's different thoughts about when you can get it for males versus females because of the growth. So that, as I said, there's no upper age limit. But yeah, in younger patients, we wait until early 20s, sometimes late teens, depends on where they are with their growth. And bone density in older adults, sometimes in an older female who's maybe missing an upper tooth. I say female because there can be osteoporosis or some bone loss, as opposed to a young, very solid male that's been weightlifting or something, might have much more solid bone. But every patient is evaluated individually to determine the best course of action.
Okay, and our final question for today, Doctor. What long-term benefits can patients expect after getting these dental implants?
Yeah, so look, the natural appearance and like we've mentioned in other podcasts, just being confident that whatever you've got there is not going to fall out, and it can look just like a tooth. It doesn't look like anything fake. Improved ability to chew and enjoy a variety of foods, the preservation of the jawbone health and prevention of further loss, enhanced speech and comfort compared to, say, a flipper or a removable appliance, and minimal maintenance beyond regular brushing, flossing, and dental checkups. I know we make it sound easy. It is easy if you know how to do it, but it is quite involved, and always encourage people to make sure that they're seeing a person who has the right, equipment and materials and tools, and not just to go with the cheapest option. It's not always the best.
Okay, and there you have it, the first edition of the series on dental implants. Big thank you to you once again, Dr. Clifford Yudelman. It's been very interesting.
Thank you, and I look forward to speaking to you next week, where we're going to talk about going, the difference between the single all the way to full mouth, all the different dental implants options. We're going to explain all of them.
Can't wait. Also to you, tuned in, thanks so much. And remember also, while we strive to provide valuable insights with this podcast, always consult with your own dental professional for advice tailored to your personal health. Don't forget to subscribe to the podcast for more enlightening discussions, and do join us again next time as we continue to explore the fascinating intersection of dental health and financial savvy. Until then, keep smiling and taking great care of your teeth.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.